Good afternoon, everybody. Thank you very much for joining us today for our COVID update. I know we've had a couple of these conversations, but really wanted to kick us off today. Myself and Dr. Jordan were on a phone call earlier with the Louisiana Department of Health with the chief medical officers and chief executive officers of all the healthcare institutions in the state of Louisiana. And what I took away from that conversation should really, I hope, resonate with the healthcare system as a whole, that the COVID numbers are out of control in the state of Louisiana, as well as other states around the country. This is primarily a result of our population in the state of Louisiana not being vaccinated. More than 90% of new admissions in hospitals are unvaccinated individuals. They continue to be younger each and every day and sicker each and every day. To delve into this a little bit further, I want to turn it over to Dr. Mac Jordan and Dr. Gerald Bryant.
The intent of these meetings is to educate, also with regards to providing a situational awareness. I think it's important that we understand exactly what's going on here in the state as well as locally in Lake Charles. Also, we want to demonstrate our support of y'all on the front lines and every day, and also express our appreciation for what you do day in, day out. We're operating in some unusual circumstances, very challenging environment. So I think we need to thank everybody for what y'all do. I think first we want to start out with just an awareness of what's going on with the pandemic and as it evolves. We've been on a lot of calls lately. Gerald and I and Devon. We've been on 2 calls last week, one call with the state and the governor. And then last Wednesday, we had a call with White House representatives. And yesterday we had another call with the state and the governor. We're having weekly calls with the governor. And this is all about what's going on at the state level. And I wish I was more positive. I'm struggling with being positive because I am very concerned about what's going on, particularly in the state. We are lagging behind what's going on in the state. Even though we are struggling with COVID, it's nowhere near the struggles elsewhere. So I want to show a first graphic, if Belinda would pull this up, and I'm going to explain this graphic to you because I think this graphic is worth more than 1,000 words. Belinda's pulling it up now. That's okay, just bear with us. But what we're getting ready to show is a timeline of the pandemic as it evolved. And basically it's demonstrating the patients in the hospitals. So the pandemic evolution, a number of COVID patients in the hospital. If you look to the far left of this graphic, you can see when the pandemic started, post Mardi Gras back in 2020. And you can see us increasing as a state. This is the state numbers. This is not Lake Charles or Southwest Louisiana. But you can see we picked up and peaked a little below 2,000 hospitalized patients. Those numbers may be hard for you to read, but I think you can see the overall trends of what happened. So the first surge of the pandemic was really post Mardi Gras, had to do a lot with nursing home patients. And it peaked around the 3rd and 4th week of April, and then came down. And I can remember this very well because I think a lot of us thought, we're one and done. We relaxed. I can remember actually there were 4 days, the last week of May 2020, where we had 0 patients with COVID in the hospital. And that's the last time we've been COVID free, was those 4 days in the end of May of 2020. And I personally thought we could relax, and we did as I think as a nation, as a state. And then Memorial Day came, and then you can see what happened post Memorial Day starting around the end of June. And for Southwest Louisiana, the second surge, even though it wasn't as robust, wasn't as intense for the state, here in Southwest Louisiana, Lake Charles, the second surge was our worst. If you can remember, we had up to almost 60 patients in the hospital at Memorial with COVID. We were up to 16, 17 ventilators. We led the nation, Lake Charles led the nation in new per capita COVID cases for about 2 or 3 days in a row back in July. We had assistance from the federal government in the form of DMAT teams. DMAT stands for Disaster Medical Assistance Teams. We were not in a good place at all. And thank goodness we survived that surge and it came down again. Then the post-holiday surge, you can see the third surge. And one thing to note, look at what these surges are doing. That they're becoming longer and longer. They're becoming broader. There's more area under the curve. And the last surge, the state peaked out at 2,069. It says 66, but I think the actual number is 69 hospitalizations. And that peaked around the end part of December, first part of January, and started coming down. But unfortunately, and I think we were hoping that the surges were behind us, and that was hopefully the thinking. But you could see what's happened in the state beginning July 1. In July 1, the state had 241 patients in the hospital with COVID. And you can see what's happened since July 1 for the state. Yesterday, we reached a record of over 2,112 patients in the hospital. And you can see how steep that is and how quickly has accelerated. And that's, I'll talk a little bit more about what's going on in other areas of the state, but that's very concerning. For Southwest Louisiana, we lagged behind this time frame. We didn't start going up till about the second or third week in July. Middle part of July, we had probably 7 patients. We got down to the lowest 5 patients in the hospital and 0 vents the first or second week in July. And then we bumped up to 10 patients and 1 ventilator. Then over one weekend, we went from 10 patients and 1 ventilator to 30 patients. So our surge in Southwest Louisiana began in earnest the middle of the month. So we're lagging behind the state, and that scares me because what's happening in the state, it's very, very, it's sad and scary. So the next graphic I want to show you, and I apologize, but I'll explain it. These are the top 20 hospitals as of, I think that's 2 days ago. Yesterday's was released pretty late, and unfortunately the numbers are continuing to grow. And what this lists, the 20 hospitals with the highest COVID hospitalization rate. And at the top of the list is Ochsner Medical Center in New Orleans with 131. I will tell you they're getting close to 140 as of yesterday. But to put things in perspective, July 1, Ochsner had 15 patients in their hospital with COVID. So think about that. They've gone from 15 patients July 1 to 131 in a little over a month. The second hospital on the list is Our Lady of the Lake Regional Medical Center in Baton Rouge. They are at 124 2 days ago. They're continuing to increase. I think they too are in the 130s as of yesterday evening. And again, they had 21 patients on July 1. 21 patients in the hospital July 1, now 124 with COVID. So much bigger hospitals than Memorial, right? Well, let's go down to the next grouping of hospitals. St. Tammany Parish Hospital, Baton Rouge General, North Oaks. Those hospitals approximate our size and capacity. St. Tammany Parish has 94 patients, Baton Rouge General 90, North Oaks 89. And they too, the 1st of July, were, I think, in single digits. I'm pretty sure they were. So they've gone from single digits to almost triple digits in that time frame. And I'll tell you, it's hard for me to fathom what this hospital would look like with 90 COVID patients in the hospital. And that's what scares me. We're lagging behind the rest of the state, and I'm worried that we could be moving in that direction. We are on the bottom part of this graph. Lake Charles Memorial, if you go down to the last 3 hospitals, Lake Charles Memorial's got 35, Ochsner and Kenner, and Rapides has all 35. But these numbers are going up pretty significantly, very fastly. And that's the context of where we are today. And that's what I mean. I want to give you a situational awareness of what's going on. So yesterday, I don't have today's numbers yet, but yesterday we were at 38 COVID patients in the hospital. And I really want to show this graphic too, because this is an incredible situational awareness tool that the marketing team in collaboration with the quality team has put on our social media pages. And this is very informative for a lot of reasons. I think it shows the sudden increase, the explosion in COVID patients at Memorial. And also, I will tell you, when I was on a state call with the White House a week ago, I commented that we weren't really seeing ventilated patients like the rest of the country. Well, that changed in a matter of 3 or 4 days, because I think on one day we intubated anywhere from 4 to 5 patients in a very short time frame. So what we're seeing is two things. We're seeing a lot of young people being ventilated, and the average age here at Memorial and throughout the state is dropped significantly. The average age for the patient in the hospital is in the low 50s. So we're seeing the acuity start to escalate a lot. And again, it's a very younger population than where we were this time last year. The breakthrough is getting a lot of attention. And people say, well, what is our breakthrough? It's certainly, you hear about breakthrough nationally, but this was where we were a couple of days ago. It will be updated, but you can see that out of the 38 people in the hospital, there was one patient that was vaccinated. That's in the age of 50 to 59. There was one patient vaccinated in the hospital. And talking to our critical care team, they are not aware of anybody that was vaccinated that had to be in the ICU. So I think one of the take-home messages, people say, well, what's the use in getting vaccinated? It doesn't prevent me from being hospitalized. Well, it's not perfect, you're right, but it keeps you from getting critically sick and dying. And we have numbers to support that. But basically that shows you the age breakdown of where we are. We're seeing a lot of young people in the hospital. And this is a disease of the unvaccinated today. A year ago, COVID was probably unpreventable. We talked about mitigating measures and flattening the curve. That had nothing to do with preventing COVID. All that was slowing the spread to where hospitals like Memorial could survive and take care of the community. Today we live in a much different world, and we're going to talk about vaccines. COVID is largely 90+ percent preventable. So that's the heartache. We're seeing people hospitalized, getting sick, having long haul COVID symptoms for months, and even having people pass away unnecessarily. And that to me is the tragedy of the situation. Monoclonal antibody was a huge breakthrough last fall. It was the very first treatment for outpatients, and this organization led the region in implementing it and administering monoclonal antibody. We've had to adjust the cocktail because of the variants. We're starting to see variants evolve that are different from the native COVID or the original COVID. These variants, I guess, think of them as cousins. These cousins are they're bad actors. They're much more transmissible. Not sure about whether they're actually more deadly, but they're more transmissible, and the fact that there's more virus in the body could probably make them more deadly. But what we do know, it's much more transmissible, easier to spread. Our positivity rate in the community is, Dr. Heyman on a call with the governor at St. Patrick's stated that their positivity rate for one day was 40%, which is just, I don't know what to say. 4 out of 10 people are positive for COVID that they tested. Universally throughout the state, it's very common to hear positivity rates in the mid 30s. So 1 out of 3 people in the state are positive for COVID. We have implemented the drive-through testing in the ED parking lot, and one heartening thing is we're seeing a lot of people want to get tested. People are now beginning to get a lot more concerned, and we're seeing a lot of testing. But going back to the monoclonal antibody, we've seen a tremendous uptick in the administration of monoclonal antibody. 3 weeks ago, 4 weeks ago, we were probably giving 2 infusions a day. That changed dramatically this past weekend. The team, and again, compliments to the team. Nothing gets done by a single person. All these achievements are done by team. So that team was able to administer 36 infusions Saturday and Sunday to patients. And this is so important because these monoclonal antibodies prevent hospitalizations and death, just like the vaccine. And oh, by the way, it's a EUA as well. It's kind of interesting. People want the monoclonal antibody, even though it's a EUA, but sometimes people use the EUA as a reason not to get vaccinated. But that too, the monoclonal antibody is saving lives and hospitalizations. We are seeing the increase in monoclonal antibody almost to 30 infusions a day. And the one thing that separates Memorial from what's going on in the rest of the state, our team is able, once they get the request, we're getting this infusion done very timely in about a 24-hour time frame. And I'll tell you, the rest of the state's struggling with this. And we know that the earlier you can give the infusion, the better it is for the patient. And we're meeting a 24-hour, I'll fudge a little bit and I'll say 36-hour turnaround. A lot of places in the state, they're 2 to 3 days. I want to talk a little bit about resources. And on the very front end, I'm going to ask Gerald to comment about our nursing challenges, staffing challenges in general. But I'll tell you, our PPE, our non-human resources are holding out. But our most important resources are y'all, the human element, our team. And we're starting to see quite a bit of uptick in people getting COVID and having to stay away from work. So, Gerald, would you mind stepping in and talking a little bit about this?
So as far as the systems activities that we put in place to try to stay ahead of the curve on this thing, last week we actually, as this began to evolve and we saw literally the tripling of COVID admissions over one weekend, we opened our incident command center. So we are currently operating under our disaster plan through our incident command center. We huddle twice a day. We include a COVID update in our morning safety huddle, and then we have a 1 o'clock huddle again in the afternoon every day to see where the system is with things. A couple of things that we've done besides the incident command center, as Dr. Jordan said, our personal protective equipment is in good order. Our respiratory support equipment is in good order. The team, our respiratory therapy team and pulmonologists are staying on top of that. We've ordered additional equipment in case the community needs more than what we had already in stock here to take care of folks. So some of that equipment began to come in yesterday, actually, to stay ahead of the curve. The biggest concern is, as Max said, is human resources. As of yesterday, there were close to 50 of our team out with COVID. That impacts our ability to meet our mission to the community, our obligation to the community when we don't have people here to run the hospital on whatever shift it is or whatever their job is. And a significant number of those are direct care providers that are out as well. We have looked at this as we try to meet our our obligation to the community and stepping up to the plate. We have opened in the computer system, should we have to use them. Our old semi-private beds are rebuilt in the computer so that if we had to activate semi-privates, we can do that. And we have some beds on rehab we can convert over. That's if we can staff those. We have already pushed the nurse-patient ratios to a 6-to-1, and in some cases a 7-to-1, where our goal is 5-to-1 in the organization. And just being clear, as your chief nursing officer, when you push a nurse-patient ratio 6-to-1 and 7-to-1, something doesn't get done. Their care gets triaged, and that's what the frontline staff are dealing with. We've activated additional nursing resources by taking nurses who aren't at the bedside and putting them back in direct patient care to our ER and to the monoclonal antibody team. Our stroke team, our trauma team, and nursing excellence team went to the ER, and our informatics nurses all are administering the monoclonal antibody to keep patients out of the hospital. And we've got a few other levers we can pull if this continues to evolve. We enacted this week mandatory overtime for the nursing family and the organization. And that doesn't come easy because we're telling people to take care of themselves, but we're also telling them they have to work more to get everybody taken care of. So it's tough. I do want to share one little tidbit of information as this comes through and Matt begins to talk about the vaccine. The reality of this is we've stayed in the 30s this week so far with our patient census. Yesterday, our 9th floor ICU team lost 3 patients in one day. These were not 80-year-olds that were from nursing homes. These were younger people. They didn't have a lot of comorbidities at all. In some cases, these were people who were unvaccinated, who got COVID and did not make it out of our hospital alive. These are 3 people in one day from Southwest Louisiana, our friends, our neighbors, that didn't make it out of here alive because of this disease, despite our team's best efforts up there. So that's kind of a little bit of awareness of what the system's working on. We committed to this community and committed to one another to do our best to take care of everybody. It's increasingly difficult. We do worry that this is coming at us pretty much full steam ahead, and we will be in a situation where we're holding admissions in ER like every other hospital in the state for the most part. And when that happens, people with strokes and heart attacks don't get to where they need to go in a timely manner. It's not just a disease, an impact to those who get COVID. It's an impact to everybody in the community that needs health care.
Yeah, and again, we're not trying to be pessimistic. I'm being as real with you as I can on these calls and listening to the chief medical officers and health leaders from other hospitals in the state. There's a sense of just, you can hear it, helplessness, hopelessness. There's patients in the ERs right now. Rapides had 26 holding in the ER yesterday, and these patients had no place to go. There's no ability to transfer to any facility elsewhere. There was to a high level of care. There was no capability to put these people on ventilators. These were patients that were just on a stretcher in the ER with oxygen. And that's a standard of care that we are trying to avoid as best we can, because we are all committed to a higher standard of care than just parking a loved one in the emergency room and giving them an oxygen cannula and say, good luck. That's just, anyway. I want to talk about the vaccine because I do want to educate you as best we can. And I've been saying that there has been an understanding as to the uncertainty and reluctance. And I think there has been in the past, but I think that understanding should be, as far as reluctance, should be going away because we're learning more and more about the vaccine. But it was understandable in the past year why there was a lot of confusion about the science of not just the vaccine, but COVID in general. When we started out with this pandemic, there was a lot of changing narrative from a lot of different health organizations, including World Health Organization and CDC. Changing narrative about how to diagnose it with what test, how long to leave somebody in quarantine, what was the best way to treat it. So there was a lot of changing narrative that certainly could cause people to wonder. But the reason that narrative was changing is that we were releasing or disseminating scientific discovery real time. Almost the day it was discovered. The transparency is a wonderful thing. Don't get me wrong, and I'm not speaking against transparency. But previous process was before we announced, the scientific community announced progress, it had been scrutinized with peer review methods, and usually it wasn't released until several months of study. And that wasn't the case during this pandemic. And I'm not saying it should have been. I think we were under a crisis. So I think, but that explains why the narrative changed so much. And I'm going to say, yeah, masking was part of that changing narrative. But today, I think there should be less uncertainty and reluctance. And what we've gotten is a vaccine that was underdeveloped not just for a few months, but quite literally, the messenger RNA technology was being worked on in the 70s. When I was in high school, that's a long time ago, right? Back in the 70s, researchers on the East Coast were taking messenger RNA and trying to figure out how to introduce that in the cell. So y'all fact check me, go to Google, messenger RNA, we all have messenger RNA in our body. Messenger RNA is nothing more than a cookbook that travels from the nucleus of the cell with the ingredients for protein synthesis, moves from the nucleus to the cytoplasm, where that cookbook, the ingredients begin to produce protein. That's occurring in our body every day. What messenger RNA was identified, and it really, the first novel coronavirus back in 2003, which was SARS, and it was in China, and it lasted about a year. They began using that messenger RNA and actually developed vaccines. They had a vaccine, a messenger RNA vaccine in 2003. And I've been reading the last couple of days, it was actually introduced into some humans back in 2003. Thank goodness the original novel coronavirus, SARS, was short-lived. But the second novel coronavirus was the Middle Eastern Respiratory Syndrome, MERS, back in 2012. There was more work done on the messenger RNA vaccine in 2012. So there had been a lot of background work. There had already been vaccines put in humans prior to SARS-CoV-2 being discovered by the Chinese in the winter of 2019. And there was an unprecedented development of this messenger RNA vaccine because there was global cooperation between countries, between pharmaceutical industries, between healthcare, and there was a lot of money put into it by governments of the world. And also, instead of doing things in a linear fashion where it was like a domino effect, we were doing things in parallel, and we avoided a lot of the bureaucracy, and we got the vaccine to where the FDA felt comfortable granting an EUA in December of 2020. EUA is Emergency Use Authorization. But since then, we've had a tremendous amount of experience with the vaccine, over 340 million doses. We felt very comfortable early on with it, but I'll tell you today where we stand is a very safe vaccine. Not only is it very safe, it's very effective. And even though there's breakthroughs, by and large, it's 94% effective. It saves lives today. Personally, I've taken it. My wife, who's immunocompromised, taken it, and my daughter-in-law, who is pregnant with twins, has taken it. I believe in that much, and you need to hear that. So, yes, I'm trying to convince people who haven't taken it to take it. I believe, and why we're here today, I just want to say this, really why we're here today is we care. We care about you, we care about this community, and we're trying to stop needless deaths and hospitalizations. So I want to thank you. I want to end by first thanking you for what you do every day. When you work at Memorial, you're in a position to make a huge difference in this community every day, and y'all do. And we couldn't do it without you. And I just want to close by thanking you for what you do, and I want to thank you for your time this morning. So with that.
Real quick, guys, just so that you know the avenue. Employee Health is open Monday through Friday and available to give vaccines. So all you have to do is contact Employee Health, and want to be clear that Dr. Katie O'Neill, the Chief Medical Officer for Our Lady of the Lake in Baton Rouge, made a public statement the other night, and it really resonated with me. And her ask to the citizens of Louisiana was to get vaccinated tomorrow, get vaccinated today. And as she said, if you get vaccinated today with it and you mask over the next couple of weeks, I will not see you in my hospital and definitely won't see you in my ICU because you will have built some degree of immunity to protect yourself from this particular variant. So if you made a decision up to this point not to get vaccinated, or you haven't made a decision, please take an introspective look at this, take a relook at it, and consider getting vaccinated, and getting vaccinated sooner than later. Not next week, but the sooner the better. The safer you are and the safer we all are, the sooner we get vaccinated.
I think my plea organizationally to everyone, as Max said, we're a family, and we will see our family members become gravely ill. We will see our family members die. This is becoming a public health crisis, and we will soon reach the inflection point where we have so many staff members that are sick with this preventable disease that we cannot care for the community. Caring for this community, that is our driving mission. Taking care of the people that entrust us for their health care. And we want and need to be there to meet those needs. And then personally, and we want you to be safe. The numbers are out there as far as prevention of hospitalization and prevention of untimely death. We want you to be safe. We want your families to be safe. We want your children to be safe. We want your loved ones to be safe. So with that, we ask, please make the decision to be vaccinated. We're not at the point of mandating it yet. You will continue to see health systems across the state and across the country mandate vaccination for their healthcare workers or for all employees. We're not there yet, but folks, if this continues to burn the way that it's doing, either there will be a legislative mandate or all health systems will follow suit. Please make the decision. Keep yourself safe, keep your family safe, keep our patients safe, and keep the community safe. With that, we say thank you for your time, and we'll be back in touch.